The Ebola outbreak in Africa could infect over 20,000 people in just a matter of months. CCTV's Jim Spellman has more.
Mike, the report lays out a roadmap to contain the outbreak in 6 to 9 months, but it won't be easy and it won't be cheap. It's already the biggest outbreak of Ebola on record. 3,000 reported cases and 1,400 deaths. Now, the World Health Organization says those numbers may grow much bigger, possibly infecting up to 20,000 people.
Unfortunately, not only are the numbers large, but we know that there are many more cases than have been diagnosed and reported, and that cases are increasing. I wish I didn't have to say this, but it is going to get worse before it gets better.
To stem the outbreak, the WHO has laid out a new so-called roadmap with 3 objectives. First, treat and isolate patients in heavily impacted countries like Guinea, Liberia, and Sierra Leone. Second, contain the spread of the disease in neighboring countries like Nigeria, which has just a few cases. Third, stop any spread of the disease to additional countries through better preparation and response to new cases.
At the moment, our leaders say that they would estimate 6 to 9 months before this outbreak can be contained, and you really want to feel that you really want to see no more cases of Ebola. That's when you know it's contained.
But local treatment centers are already overwhelmed.
It is really an extremely challenging situation for everyone. And MSF, we can't do more than we're doing now. We've opened this center a week ago. It's completely full today.
To implement the WHO plan will require more expert staff, better training, and specialized equipment, including access to better equipment to quickly and accurately diagnose the virus, allowing for rapid isolation and treatment. The cost, an estimated $490 million from local governments and the international community, including the World Bank and the WHO. An unprecedented number of healthcare workers have been infected with Ebola during this current outbreak. The roadmap calls for special treatment centers for these caregivers, the thinking being that doctors and nurses are simply too valuable in heavily affected areas to lose any of them to the disease, Mike.
And Jim, how close are these researchers to a vaccine, would you say?
That would be the real key to preventing future outbreaks. The first trials of the vaccine will begin next week at the U.S. National Institutes of Health outside Washington. The trial begins with just 20 healthy adults to see if the vaccine is safe. Then testing would expand into Africa. Testing is being fast-tracked because of the current outbreak, but it can take months to complete testing, and even if the vaccine is proven safe and effective, probably will not be ready in time to have much impact on this current outbreak, Mike.
All right, Jim Spellman from our newsroom, thank you.